Hi, I'm Wendy. Welcome to Baby on Board. In this video we will discuss mastitis, why you get it, how to prevent it and treatment. What is mastitis? It is usually the result of ducts becoming blocked. Basically it's plumbing. When you have a blocked milk duct, milk backs up behind the blockage and makes the breast inflamed. Early symptoms make you feel as if you are getting the flu. You feel shivery and achy, and symptoms come on very quickly. Later symptoms are soreness and redness on the breast, with the breast being painful to the touch. You may have a temperature of over 38 degrees Celsius. This is not a good time to wean. If you have a high temperature and redness of your breast, the best option is to see your doctor and get a course of antibiotics. You need to take the antibiotics for 10 to 14 days. The usual dose is 500 milligrams of dicloxacillin or Keflex or amoxicillin 4 times a day. As a lactation consultant, I used to see a lot of mums with so-called recurrent mastitis, and it was actually unresolved mastitis, as mums were often not given enough antibiotics, or the antibiotics were given for too short a duration. So you need to have the right dose for the right length of time, which is 10 to 14 days. The antibiotics may predispose you to thrush, so take some probiotics with them. You can buy probiotics from your health food shop. 1 in 5 women get mastitis during the first 6 months, so it is a situation that a lot of women experience. Early on in an episode of mastitis, try cold packs to relieve inflammation and an anti-inflammatory. Other things that help are starting the baby on the sore breast first, as that is when the suckling is strongest, and breastfeed often. Position your baby's chin towards the blocked area. This will help with clearing the blockage. Massage your breast gently as baby feeds and apply warmth to the breast just before a feed, as this can help. Wearing a bra without any uplifting wires or even no bra can help mastitis resolve. The classic time to get mastitis is either in the first few weeks when your nipples are damaged, or when baby sleeps through and you miss a few feeds. If you have missed a feed and your breast is uncomfortably full, express a small amount for comfort. Don't express all the milk, as your breast will fill up again. Alternate breasts at each feed as a general rule, and this will help both breasts to drain properly. You can prevent mastitis by ensuring that your baby is well attached. Never try to abruptly wean, as mastitis is practically a certainty. If you are desperate to wean, there is a drug that you can take which will dry your milk up, but it has to be prescribed by a medical practitioner, and once you have taken it, you cannot put your baby back to the breast for at least 2 weeks. So you have to be very certain that breastfeeding is not for you anymore. The most important part of treatment of mastitis is the frequent removal of milk by either expressing or feeding, at least 8 times in 24 hours. Milk supply usually decreases during a bout of mastitis, but will return to normal with more frequent feeds when the mastitis clears. You can get stringy bits of milk when you express during this time, and the milk generally becomes more salty, so baby might refuse it. Often the affected area may feel bruised for a week or so as the attack subsides. As long as you have taken the right amount of antibiotics for the right length of time, 10 to 14 days, this should resolve. Of course, if you have any pain remaining, return to see your doctor. Other tips which will make a reoccurrence unlikely are regularly examining your breasts, and if an area is getting lumpy, massage the lump away during a feed. If you have a lump that lasts longer than 2 weeks and does not get smaller with feeding, This needs to be investigated with a diagnostic ultrasound to rule out other causes. Drink to thirst and get enough sleep, and do not sleep on your stomach. Make sure that your clothing is not too tight and that your bra fits well. Don't press on your breast with your fingers during a feed. As mentioned, massaging gently is okay. Holding your breast tightly, as some mums do, will predispose you to lumps. I hope you do not ever get mastitis, but if you do, that it resolves speedily. If you found any of this information useful, please subscribe, as you will be notified when my next video is available. If you click or tap the video on the top left-hand corner of the screen, it will take you to another related video. Please visit my YouTube channel, Baby on Board with Nurse Wendy. See you next time.